Hello, everyone. Hello, my name is Dr. Timothy Brown. I am a board member for the National Optometric Foundation, Director of Education, and I'm excited to be on with you on this webinar, Protecting the Vision. And we're going to have a dynamic guest speaker on with us. I'll introduce him later for the show. And I just want to tell you a little bit about who we are as the National Optometric Foundation, and also our parent association, the National Optometric Association. We're the financial arm supporting the National Optometric Association and our student organization, the National Optometric Student Association. We're supporting the student association with scholarships, trying to help them get to the conferences, also supporting them and as they're in school, supporting students who are in high school thinking about going to optometry school, supporting the NOA at our conferences each year. We are teaming with them to provide eye exams to communities that's underserved, underrepresented, partnering with companies like VSP who come alongside the NOA and provide frames and lenses for patients who get their eye exam done each year as we're traveling to different states, different cities, different communities each year for the National Optometric Association convention. And we're going to be in St. Louis, Missouri this year for the NOA convention. Looking forward to partnering with the technicians and students and our volunteers, doctors, associates, all of those who come out to help us serve these communities. We have a great time. We do take breaks where we try to have one shift come on in the morning up to noon, and then the next shift comes from noon until that afternoon. So those of you who may be watching this webinar, you'd like to join us, Serve Where You Go is the name of the event for the NOA. We'll be glad to have you to help us in St. Louis, Missouri. We also try to provide education to communities, talking about the 3 silent killers of vision. We're always trying to highlight this because we don't want people to lose their vision. Diabetic retinopathy, glaucoma, hypertensive retinopathy, these are things that can slowly start to steal your vision, and we don't want that to happen to you. So we want you to be educated. We want you to know about these things. Some of these things we've talked about on our webinar previously with speakers, and you can go back and look at those videos, especially for the month of January. We talked about glaucoma. That would be on our YouTube channel. We have a YouTube channel, National Optometric Foundation. We want to ask that you go and subscribe to our YouTube channel so that you can stay informed about these things and share them with your family members. We also have a website, the website www.nationaloptometricfoundation.com. We're on Facebook under the same name, National Optometric Foundation. Asks you to go and like our Facebook page so that you can stay connected with us. And if you would like to donate and allow us to be able to do the things that we're doing for communities around the world, you can go ahead and subscribe, send us a Cash App donation today, even if it's just $10. We will take that. We will be thankful for it. $ protecting the vision. You can send it to our Cash App as well. Thank you to all of you who have donated in the past. Thank you for all of those who have donated. If someone's doing a fundraiser on Facebook, you're donated to their birthday fundraiser. Thank you so much for those contributions. They are helping us greatly, and we appreciate you for doing that. I'm also going to ask that you go to our website and make sure you subscribe to the website because we can send you some additional information. You can find out about our board members, and you can see some of the photos from events that we've participated in with the NOA. I'm excited to be with you tonight to talk on the topic of multiple sclerosis. Our guest speaker is going to have a case that he wants to share with you as well, and some information, some things that you should be aware of. And maybe you have a family member or a friend who may be dealing with MS. This would be a great webinar for you to invite them in. So go ahead and share this link with your family and friends and tell them to come on in, get their favorite drink, get some popcorn, and get ready to listen in as Dr. Optometric Jones, graduate of UAB in 2025, May of 2025, graduate of UAB. And he actually did a dual degree and got his Master of Business Administration as well there. And just to highlight some things of his involvement in the community, when he was a third-year student at UAB, he became an Albert fellow back in 2023, 2024, completing a year-long Hispanic community outreach project, partnering with a local nonprofit organization to create an educational library using social media reels with visual health information and resources to educate people about common vision disorders and diseases. He's currently active duty as an optometrist in the U.S. Air Force, servicing our airmen and military staff. Dr. Jones' passion for vision care started as a young child raised in Memphis, Tennessee, where he feared losing his sight completely because of progressive nearsightedness. He's thankful for the optometric care he received. He's excited to share knowledge about vision health, warning signs, and proper care. We're excited, National Optometric Foundation and the National Optometric Association, to have him on this webinar with us tonight. Dr. Jones, welcome to the webinar. We're so excited that you're on with us. And if I left anything out that you would like to share about yourself with our listening audience, please do so at this time. But I'm excited to see your face here on this webinar. Thank you.
Yes, sir. Thank you, Dr. Brown. I really appreciate the opportunity. And I think you hit everything that I would have said. I appreciate that. Also, thank you to the NOF and the NOA for having me here for this opportunity. I do want to say that when it comes to multiple sclerosis, I'm not like a subject expert on it, but I do want to help present this case and make people aware of how important it is to get their eyes checked and preserve their vision. So thank you for this opportunity.
Absolutely. You know, even if you're not an expert, I know that you have information that's going to be impactful and it's going to be helpful to our listening audience. And so I'm excited about what you're going to share with us tonight. And I know that if anybody have questions, we'll do our very best to try to answer those questions. You can post them in the comment section. If you're watching this live on YouTube, you can put in the comment section. We'll be checking that and trying to get those questions. Or if you want to make comments there, if you're a fan of Dr. Jones, you can go and give a shout out to Dr. Jones and show him some love in the comment section, and we'll highlight those things as well there too. Dr. Jones, again, we're grateful that you are here to share. I know you have some information that you would like to bring here for our listening audience. And as far as me on this side, speaking for our listening audience, I want to just ask you, you know, what is multiple sclerosis and what effect does it have on the body? If you could just start there and some of that knowledge and information to share.
Yes, sir. So when it comes to multiple sclerosis, it's an autoimmune disorder. It's a long-term condition. And it's basically the body's immune system attacking the nerves and the brain and the spinal cord. And mainly the brain and spinal cord, that's your central nervous system. So in simple terms, the body is basically getting confused and attacking itself. That's what categorizes as like an autoimmune disorder. And if you think of the nerves, they're like electrical wires. And with this disorder, it's starting to damage those electrical wires. They're protected by a covering called myelin. And this disorder basically starts to deteriorate that myelin. And the whole important thing about myelin that it helps signals travel quickly and smoothly between your brain and the rest of your body. So the immune system, it's, you know, like I said, confused and making this attack. So when it does that, signals start to slow down, messages get distorted, or they don't process at all. And as we can already assume, or we already know, that the brain and spinal cord have a lot of functions for the body. What branches off the brain and spinal cord is your peripheral nervous system, but you can only imagine if the central part is being affected to such a great degree, then the other parts of the body are also not functioning well. So it can affect the body in different ways. Some people experience numbness or fatigue, balance problems, weakness, and some people even have visual changes.
We've had cases of people coming in talking about their diagnosis of MS and wondering how it may affect their eyes, their sight and everything, you know, and those vision changes that some of them have had was like double vision that they may have later on when they have this case of MS there. Um,
Yes, sir.
do you have cases that you would like to present to us or talk about when it comes to MS and vision and how the communication between the brain and the body is interrupted when it comes to MS?
Yes, sir. I do have a case. So when it comes to MS, it's not rare by any means, but it's also not very, very common. So when I first received, when this patient first came to the office, I was a fourth year student at UAB, and my attending, shout out Dr. Rebecca Godet, we saw this young lady, and she's 29. At that time, she was 29. She's a white female, and she was complaining of sudden vision loss. The way she described it was her vision was dim in one eye, basically her left eye. And it wasn't completely dim all over. She noticed more so at the bottom of her vision and out to the side, and just the left eye. And that started for her the day before. So she decided to come in and see what was going on. She also told us that 3 days prior, she was having pain behind that same eye. And just one other important thing to note about her, she was not pregnant at the time, but she was nursing a 5-month-old baby. So I think she was doing all she can to look after her own health, but she also has other responsibilities. So that was the main thing when she came in. And it's kind of hard to forget her because she was so apologetic. She felt like, it's like, oh, I'm sorry. It's probably nothing at all. But, I just wanted to come in and check it out. I'm having this pain and all of a sudden I'm losing vision. So it's nothing, right? It's nothing. I was like, well, it's probably not nothing. So I'm glad you decided to come in and, check it out and see what's going on. But I just remember her being so sweet and very, very polite. And with those symptoms, like that's scary because you can only imagine how that is. I feel like a lot of times with people, they don't really care about their eyes. And I say that with respect. Like, I've known people that have never had an eye exam and they're like 50 or even older. But when that vision starts to change, they're like, okay, let me go check this out. So people normally don't care until something bad goes on. So I was just thankful that she didn't wait too long. She came in the very next day after having this sudden loss of vision, and we were able to get her the help she needed.
I'm here. That's very interesting, Dr. Jones. And you said something that I often say to people as well, that I think we take our eyesight for granted, and we wait and we wait and we procrastinate before we go and get our eyes checked. If we're not having any symptoms, if we're not having any signs, or there are no signs, or we're not losing vision, we just continue to use our eyes on a daily basis, and they don't get a lot of rest sometimes. We might get about 4 or 5 hours of sleep, and then we just get up the next day and we push ourselves some more. But it's important that people get their eyes examined, even if you're not having problems. I always tell people, don't delay, do it today. Go in, see your local optometrist, get on their schedule, make sure you get that eye exam because it can be life-saving. As optometrists, we can find so much that's affecting your body, and we can see it through your eyes. And a lot of your history is important that you give to your optometrist as well. Like you say, this young lady comes in thinking nothing bad, just losing some sight, a little bit of pain behind the eye, it's probably nothing bad, but it turned out to be, significant, and it's very important. So we don't want you guys to delay. We don't want you to put it off. I'm speaking to those of you who are watching this webinar and you've been delaying getting your eye exam scheduled. After this webinar, before this webinar is over, I want you to call your optometrist, leave them a message because they're closed right now. It's after 5:30, but leave them a message to call you back because you need to schedule your eye exam. We don't want you to delay this. The reason why we do these webinars is because we want to protect the vision. We don't want you guys to lose sight. And so Dr. Jones has presented a patient case telling us how she came in and what her main complaints were. It's significant. Any changes in your vision, you should be concerned. You should contact your optometrist and make them aware of that. And you should also not hide on your patient history form any of your history when it comes to medical, even if it's not related to your eyes. Diabetes, high blood pressure, all of those things should be made known to your optometrist. Autoimmune. So he's talking to you about what autoimmune means, and that's important. So take some notes, share this webinar with your family and friends because we want you to leave this webinar better than you came. All right, Dr. Jones, I want to ask you now about this patient because now you have me interested. She came in thinking maybe not so bad, doc, pain behind my eyes, feel like I'm losing some vision. What significant did you find? Do you find anything significant from this? And how do you guys go along with any type of course of action or treatment when it came to your findings?
Yes, sir. I'll gladly answer that. But I also wanted to touch on what you said because we found out some very vital information from her after the fact, actually from another doctor's notes. We had sent her to an ophthalmologist. We'll get to that as well. But it just so happened that she had another symptom that she thought was completely unrelated. And it got to a point she finally disclosed it to her ophthalmologist saying that her right arm had been numb for like 5 months. And I mean, I can only imagine why somebody would not investigate that. Like, why would you not get that checked out? But
5 months.
I'm sorry, what was that?
Right? I was just making sure that I heard you right. Her right arm numb for 5 months.
Yes, sir.
Yes,
sir.
So those of you who are listening, Dr. Jones is telling you that's not normal, and you should get that checked. Right. Okay. I'm just making sure. Okay. Yes.
Right. And after doing a little bit of research, I found out that that's basically was a early sign of MS because like people are not. It's an autoimmune disorder, but people are normally diagnosed in their 20s to 40s. She was 29. And she had been having that symptom for 5 months, but that also makes MS somewhat difficult to diagnose because symptoms can come and go. They may last for days or weeks and then partially resolve or seem to completely resolve. So the person may feel like, it's nothing. I'm having a little episode of some sort, but I'm fine. And the vision problems is also an early sign of MS. Especially the pain and the sudden vision loss. So I think me and my attending, we were both kind of leaning toward that's what was going on. But back to your question, like when it comes to significant findings from her presenting to us that day, all of the preliminary testing we do was pretty much normal. Her color vision was normal. A lot of like her eye movements were full, even though she had pain behind that left eye, her eye movements were full. Her visual acuity was slightly reduced. So most people understand 20/20 being perfect vision. She was 20/20 in her right eye, but her left eye with her current correction was 20/30. So, just so we're complete about that, you have 20/20, quote unquote, perfect vision, then 20/25, then 20/30 is a little bit reduced. So not a lot of change in her vision, but reduced enough that we picked it up. So we did a lot of testing. The one that's on the screen now is a visual field of her optic nerves. So once again, MS affects the central nervous system. Not only is your brain protected by myelin, your optic nerves are too. That's why a lot of people consider your brain, spinal cord, and optic nerves to be your central nervous system because of that myelin protection. So we were looking for any type of abnormalities on her scans. Since the preliminary testing seemed to be pretty normal, let's do some specialized testing to see what's going on. Maybe we can actually reveal her ailment. So looking at this scan of her optic nerves, just to let you know, it looks pretty normal. I will say the left eye, which is visible on the right-hand side, the signal strength of that scan is not ideal. It's only 7 out of 10. We would like for it to be 10 out of 10. And you can kind of notice a little bit of dark defect on that box near the top, which kind of shows, once again, a map and the elevation of her optic nerves. But the main part, the actual optic nerve itself, is still pretty clear. And we can see that overall, it looks normal. Like this scan is normal. If we go to the OCT of her macula, it also looks normal. There's no fluid under the macula. Now, the macula is the central part of your vision. Your retina captures light and sends it to the optic nerve, which travels to the brain. But the macula is the center part. Whenever you look at something, you're using your macula to look at it. But you can also see things in your peripheral vision. But when it comes to her macula, both eyes look very normal. I think we had another scan, another OCT scan, if I'm not mistaken. Yeah, so this one kind of shows her ganglion cells, which is, still a part of the retina, but just for simplicity, like it's normal. It's nothing of concern. All of her retinal layers are intact. There's no fluid under the retina, within the retina. There's nothing abnormal. So we also dilated her eyes to get a good view, because even though she's complaining of pain behind the eye, with this sudden vision loss, it could have been a retinal detachment, some random abnormality with fluid causing this distortion. So we dilated her eyes to see a full picture of her ocular health. Now, moving on to her visual fields, if we can start with the visual field of her right eye, it's very normal because, that was not her concern nor her complaint. Her right eye had a full visual field, no defects whatsoever. But the visual field of her left eye was exactly how she described. We saw defects at the inferior portion of her visual field and the temporal portion as well. So that was, pretty significant of a finding for us to at least know that this healthy 29-year-old is having some visual changes. All of her testing was reliable and in good sense. It all makes sense. It all was correlating together. Another specialized test we do is very subjective. We did a red cap saturation test where it's literally I hold up a bottle that has a red cap and I have her view that color red with her good eye first. So for her, with her right eye. And then I just explained to her, if you can appreciate this red color as 100% red, we're going to see how it looks with the eye that you're complaining about. So then she switches fixation, covers her right eye. Now she's viewing with her left eye. And she reported that it looked about 75% as bright as it did with just her right eye. So that alone lets us know that there's likely something wrong with her optic nerve. Now, one other test I wanted to mention when it comes to the preliminary testing, we always check pupils to make sure that they're moving equally, that there's no what we call an APD, which is a afferent pupillary defect, which basically is testing to see, does the eye have an issue transmitting the signal of light? Because when your eyes see light, the pupil should constrict to reduce how much light is going into the eye. But we did all of that testing. All of that preliminary testing was normal. Once again, when it comes to normal color vision, she could still see red, green, blue, all of that. But the color red was a little bit desaturated in her left eye. So the visual field in that test was very important when it comes to understanding that there is something going on. Could we say exactly what it is? No. We were kind of thinking maybe it was some kind of retrobulbar, which just means behind the eye. Something going on behind the eye. It could be optic neuritis. It could be posterior scleritis. Not exactly sure. We just knew there was something wrong.
But in order for you guys to detect that something was wrong and to continue to do the examination to see what was going on, she had to come into the office. And that's what we were going to try to make sure that people understand that's watching. You got to get into the office there. Go see your optometrist if something is not right. And also, just for your annual eye exam, see your local optometrist and get on their schedule so that we can make sure when we do that comprehensive eye exam that we're not just looking for glasses prescription and contact lens prescription, but we're checking your overall health, your eye health, the health of your body, making sure that we don't see signs of other things that may be going on and affecting your body overall. So, Dr. Jones, you mentioned the different things that you guys did as far as the OCT scan of the optic nerve and the macula, the red cap saturation test, visual fields that you did as well. Was there anything else that, in your opinion, should have been done at the eye hospital with this patient?
Yeah, so we sent her directly to the eye hospital. So this was just when we saw her, she was in office. And that's one of the good things about Birmingham, Alabama. They have a lot of comprehensive eye care when it comes to not only optometrists, but ophthalmologists. We knew that as far as our exam went, we did the best we could for her to gather enough data to make sure that when we do refer her, they can review that. And honestly, we knew they were going to repeat some of the same tests that we did, but they also were more equipped to do other tests, mainly a B scan. Now, a B scan that they did is basically like an ultrasound for the eye. I think most people are familiar with an ultrasound. Like if a woman is pregnant, she'll go to the doctor. They do an ultrasound to see the growing fetus, in utero. So they have that technology as well for your eyes, and they still use the same jelly. You close your eyes, they put the jelly on the eyelid, and they can see deeper structures than you can with just obviously the naked eye or some of these scans that we did. And it was pretty interesting what they found. They couldn't look for her pupil reaction because she was dilated. She went straight to this eye hospital, which was right downtown, maybe a few blocks from where she was. So she went there. And I feel like me and my attending were almost certain that, okay, she has optic neuritis. It's likely from MS. We were thinking, okay, they're going to start treatment for MS, but that's not what they did. Even with their B scan results, they went a different route. I think for them, they wanted to ensure what they were treating was what they thought it was and not just a guess. Because even with me and my attending, we both thought, well, it could be optic neuritis caused from MS, or it could be posterior scleritis. We didn't have a definitive answer on that. But we thought that when she went to the ophthalmologist at the eye hospital, they would for sure know, what was going on. So on their B scan, they noticed, as they said, enlarged nerve shadow. So if there's an enlarged nerve shadow, it could be several things. It could be inflammation, which we're expecting it to be inflammation. It could be a buildup of pressure behind the eye, like when papilledema, if there's a lot of increased intracranial pressure, it can push on the optic nerves and cause some distortion there. But they were also very complete by noting there was no T sign when it came to the B scan. And a T sign would basically be it would point very, very closely to it being posterior scleritis, but they didn't see that. T scan is kind of like a buildup of fluid around the optic nerve, but they didn't see that either. What you're seeing on the screen now is an MRI of not her scans. This is just something for comparison so you can kind of understand. This is an MRI scan of someone's brain in orbits. And if you can see it closely on there, it's pointing to the optic nerve and how it's a different color. You can kind of see it's more whitish versus the overall gray color, noting that people with MS tend to have this appearance. The MRI scan will show this whitening, which is basically that the optic nerve being inflamed. So we just knew that when she went to the hospital, they were going to give her high dose steroids because when you have this inflammation, that would be the initial treatment. Usually IV or maybe even oral steroids. That's kind of what we were thinking they would do. But they decided to go a different way. They noticed that her color vision overall was still full. She could see colors with no problem. And even though she did have pain with eye movements, that did kind of lean toward optic neuritis, likely from MS, but it wasn't definitive to them. They couldn't assess her pupils once again because she was dilated. So their plan was, okay, come back tomorrow morning. You're here now. We can't really say what's going on, but come back tomorrow morning. And they began her on ibuprofen. So she was going to take 800 milligrams of ibuprofen every 4 hours. And I was kind of thinking like, that's not enough. Like, but once again, I stay in my lane, and by default, I have to. I can't say what I could have or would have done. I'm not an ophthalmologist. I can't say that for sure. Looking back over the notes, I feel like they did what was right for her in that moment, and she agreed to it to come back the next morning and do further testing.
So at least, and that's the beauty of going to see your optometrist. And talking again to those of you who are watching this webinar, because Dr. Jones he's releasing so much great information, and he's breaking it down. He's breaking this case down for a better understanding. We work with other healthcare professionals, and in his case, he's working with ophthalmologists, eye doctors as well, specializes in certain areas of the eye, and also they get into surgery as well. So he's doing a referral out to the ophthalmologist, and they're planning to see her the next day. Is there a report on Dr. Jones, what happened at that next visit? You said they're doing the ibuprofen. Is there any other details from that visit, that follow-up visit?
Yeah, so she went to see them the very next morning. But things kind of made a turn for the worse, so to speak. So when she saw us the day before and when she saw them that one day, this was a Thursday, so she's returning on a Friday. When she saw us Thursday, her visual acuity was 20/30. And like I said, that's not far off from 20/20, just so, slightly reduced. But the very next day, her vision had declined to 2200, which is quite significant. Yeah. And on top of that, they obviously rechecked her pupils and noticed a very dense APD. So basically that's saying in that eye, there's the signal of light can go into that eye, but it's not responding to light as it should. The pupil is not constricting. So just like with MS and other things, like if that signal is not going through, the eye doesn't respond. The light signal is not causing the visual pathway to respond as normal. So they also decided this was also part of their plan. Like when she comes back, if there's any reason to test further, they would do the MRI of the brain and orbits. They would test her for other labs that cause inflammation and other problems, and also to start her on the high dose steroids. So that's basically exactly what they did. They did all of what they needed to do. I think at that point, her returning that day, they were able to say for sure, okay, you have optic neuritis. Your optic nerve is inflamed. So they began her on the high dose steroids. I think they did for 5 days. 2 days was IV steroids and 3 days was steroids by mouth. However, her vision did not improve over those 5 days. So I kind of already shared with you that she was having that arm, her right arm was numb for 5 months. And I can only assume that's when her this autoimmune disorder for her kicked in. But she's having a very, very bad episode currently with her vision and this great decline in her visual acuity. So with no improvement after that 5-day treatment, they just decided to hospitalize her for 10 days and they began plasmapheresis. So that was interesting, but it was needed. Afterwards, her vision improved after the plasmapheresis. So I think it's a blessing in disguise. It's pretty bad that she had this happen, but the fact that she jumped on it right away, she seeked the right help, and we were able to do what was necessary to get her the best care possible. And her returning the next day with those symptoms, she was in the right spot to receive care, and they did the proper protocol to get her seeing better.
And we're going to put a pin right there, Dr. Jones. This is why we keep saying, don't delay, do it today. It's important for you to get your eye exam on an annual basis. It's important for you to make sure that your children are getting in for their eye exam early versus later. If your child is 7, they need an eye exam. If they're 3, they need an eye exam to make sure everything is functioning properly, developing properly. Your husband, ladies, thank you for always getting your husbands in to the office for their eye exam. I applaud you. Thank you so much. We get the whole family in for their eye exam because we want you all to see clearly. We want you to see all of the beauty around you. And we're talking on this case of MS and how it's important that this patient got in to see Dr. Jones and his team for the things that she was experiencing. She came in with pain behind the eye, losing vision, and it led to them investigating and examining and finding more things, and then sending her out to an ophthalmology team who was able to start some additional testing and treatment and additional treatment that was needed for this patient. And we're going to go back later on. I'm going to bring Dr. Jones on later, and we're going to talk about this term that he gave us at the end of his conversation as well there. But we are the National Optometric Foundation. We have a website, www.nationaloptometricfoundation.com. We are also on YouTube. Some of you may be watching this on YouTube. You can get other episodes, other webinars that we've done over the past 3 years and share those with your family members or watch them yourself. We're also on Facebook, National Optometric Foundation, and we have a Cash App. That Cash App is there for those of you who would like to donate to the foundation and allow us to be able to support the association, support the student association with scholarships, helping them get to our conventions, our conferences, educating the public when it comes to different topics about their eyes and their body and their mental health. We want to take those donations that you're giving and continue to do the great things that we're doing in underserved, underrepresented communities, providing eye exams, partnering with people like VSP, doing these eye exams in underserved communities, highlighting the 3 silent killers of vision: diabetic retinopathy, hypertensive retinopathy, and glaucoma, making sure that we are doing our very best to preserve vision so that people do not lose their vision. I'm excited to be on with you guys today. I have our guest speaker, Dr. Jones. He can come back to the show. He's been sharing some great information, sharing some scans that's been done on this patient and this case of multiple sclerosis. And Dr. Jones, before we took that segment there, you put a word out there, plasmapheresis. What is that?
Okay, so plasmapheresis is basically plasma exchange. So I think most people understand when it comes to blood is made up of red blood cells, white blood cells, platelets, and other proteins in there. And all of that is suspended in plasma, blood plasma. So when it comes to plasmapheresis, they literally kind of think of it as like they're removing the proteins from your blood plasma that are attacking the tissues in the body. So, and it's used for like severe cases like this, when you have a severe MS relapse, and if you're not responding well to steroids, they'll go to this option to quickly filter out the blood and get those harmful proteins out of the blood. It's a pretty short-term procedure, I guess. It's usually over 2 to 3 weeks, and I think for this young lady, it was about 10 to 14 days. And they do about 5 to 7 sessions. And if I recall, I think she went through 5 sessions of this plasmapheresis. and it basically helps to stop the relapse and improve symptoms. And for her, it did just that.
That's incredible. And I applaud you and your team for the care that was provided to this patient there. And the fact that she was able to get this extra level of treatment there to bring her the help. I know I'm curious, and the listening audience, may be curious because we talked about this patient coming into you initially with 20/30 vision. And then next day coming back to see the ophthalmology team went to 2200 vision. So I'm curious, were you able to do a follow-up with this patient? And do you know her current vision stat?
So unfortunately, I wasn't able to do a follow up with her. When I saw her, it was in my fourth year, near the end of my externship rotation. So I couldn't follow up with her directly, but I do know she did return to that office to update glasses and contacts. So she basically made a full turnaround. She's able to see 2025 in glasses, which is very, very close to 2020. A whole lot better than 2200. And with an updated contact lens prescription, she can see 2020 in that eye, which is a great outcome considering where she started from.
Wow, that's incredible, Doc. That's incredible. And the care and attention that the two teams took with this patient helped protect and save her vision. It could have turned a lot worse, especially 5 months numbness in the right arm, that going on. That's a big lapse of time and everything there. But as you mentioned earlier, she was in the right place at the right time. And I'm glad that you were able to have that experience with her. And this is a great case that you presented here as well. In terms of multiple sclerosis, because I know someone who's watching, they know someone who's dealing with this, or they're connected, or they may be dealing with it themselves. Talking more on that, how common is this illness, and are there any steps to help someone? I know we always talk about preventative steps, or is there any way that you, or anything that you want to share when it comes to those two things?
So yeah, first I want to say that when it comes to multiple sclerosis, it's not contagious, so you don't have to worry about catching it from someone. It's literally just an autoimmune disorder. And like I stated earlier, it's relatively uncommon, but it's not rare. In the U.S. alone, about 1 million people live with MS. When you think about the total population of the U.S. being about 349 million, you can roughly say 1 in every 350 people have it. So you likely have a relative or a coworker, or someone even closer to you that has it, that's living with MS. It does. Researchers feel like you can't really completely prevent MS, but they do believe there are some factors that may influence the risk, like low vitamin D levels, smoking, and even certain viral infections like Epstein-Barr virus may play a factor in if you develop MS or not. But there's nothing very definitive from what I've seen. I will say that women are about 2 to 3 times more likely than men to develop MS. Doesn't mean that men can't develop it. Just women are more likely to. And it's usually diagnosed, like I said, between the ages of 20 and 40, and it's more common in people from Northern Europe. If you're from Northern Europe descent, like Denmark, Finland, Norway, Sweden, they're more predisposed, so to speak, but it can affect all racial groups.
Okay, very good. I do want to pause. I got a couple more things, as we're nearing the end of this webinar for you, but I do want to say you're getting some love from UAB. UAB is shouted out in the comments to you, and SUNY is also showing some love, and Dr. Karina from Chicagoland, one of the Regional 2 NOA trustee, showing you some love out there. Thank you guys for showing some love there. We got a love coming in from Umzel as well there. Thank you so much, guys, for showing the love to Dr. Jones. He's doing a fantastic job. Great dynamic speaker with us, sharing a case of MS with us and some significant findings when they had this case with the patient there. Dr. Jones, do you feel that, or do not feel that you gave this patient the best care possible? As you know, had time to just soak it in and think back on things and look over different things when it came to this case and reading over the notes from the ophthalmology team, do you feel that you gave them the best care, and why or why not?
I believe that we did. I feel like, sometimes in this profession, and I'm sure other professions, you may be, when it comes to timing and patient load, you may not feel like you can give every patient your undivided attention, or you may feel like you're rushing through. But as a fourth year student, especially working with Dr. Godet, like we took our time. We made sure that we did everything we knew to do to make sure we had all the data collected that would help us make a diagnosis. Even though we couldn't make a definitive diagnosis, we did all we could. Even when we referred her to the eye hospital, once again, I feel like they did what was in their standard of care for her. Like I said, I thought that she would have been started on high dose steroids right away, but I'm not an ophthalmologist. I can only make my own assumptions, and who knows, I may have did the wrong thing by doing that. So I still feel like every step of the way she received great care. Um, Even when it came to them starting the high dose steroids and then the plasmapheresis, like everything was in time for her, and she was able to restore almost all of her vision. So I strongly feel like she received great care. I'm just thankful to be a part of it. And also, such a sweet person. I'm glad that she had a great outcome. And I currently don't know how she's managing MS, if it's a moderate case, a severe case, or how she, wax and wane with that disorder. But at least she now knows her diagnosis, because before coming to us, she didn't know. So I definitely feel like she received the best care possible.
Yes, sir. Yes, sir. And I think you guys gave great care to this patient, Dr. Jones. And before we wrap up this section, I'll also let you tell us if some things that you want, our listening audience to take away from this discussion. But before we get there, Dr. Jones, I have to go back to the chat and make sure that I make it known to you that you're getting love from the University of Missouri. They're showing you some love there, so they want to make sure that you know that they are on and they're supporting you. And also from Memphis, Tennessee, Dr. Cynthia Hurd is also there showing some love to you on this webinar tonight. There, I'm always excited and I'm always thrilled and just always interested in who is out in the audience there. So I'm glad that people are letting us know where they're from, and wanted to make sure that you know that they are here listening to you as you're sharing this case as well there too. So thank you so much for that as well. Showing some love from the Air Force Optometry just popped in the comment section there as well. So I'd like to highlight those comments there as well.
Thank you. I appreciate all of it. Like, it means a lot. I really appreciate it.
Absolutely. And thank you, sir, for your service as well there, and the service that you're going to continue to provide to our airmen and also to the staff there as well, the military staff. Thank you so much for that.
My pleasure.
Is there something that you would like for our listening audience to take from this discussion when it comes to MS? I'll let you have the floor.
Well, yes, sir. The main thing is to don't delay getting your eyes checked, especially when you begin to notice visual changes. Like, just imagine if she would have waited one more day, like she may have had more severe and more permanent loss of vision. So I feel like I was proud of her for, even though in her heart she felt like she was going to waste our time and it was likely nothing, she still did her due diligence and she came in to see us. So I think that's very important. When people have a lot of pain, and sometimes people have a higher pain tolerance than others, but pain will definitely bring people in. Like if their eyes start hurting, they're on the way. But even before then, like you've been saying, Dr. Brown, it's very important to get your annual eye exam. There's so many things that are painless that steal your vision. So get your eyes checked. That's the main thing. Like you hit on the big three when it comes to, hypertensive retinopathy, diabetic retinopathy, glaucoma. And a lot of those plague the Black community more so than other communities. So it's important for, me as a Black man, I'm gonna always advocate for Black people. And I think it's very important that we and everybody get annual eye exams, get regular checkups. And if you have anything that you notice, funny, double vision, any pain or any type of blurry vision, get your eyes checked right away, because you never know how severe it is. You may think it's nothing, but it could very well be something that's trying to steal your vision.
Absolutely. Thank you, Dr. Jones. You hit some great tips and great notes there when it comes to getting your eyes examined. So thank you so much for, again, highlighting the importance of having an annual eye exam so that you're not losing vision because you didn't get your eyes examined by an optometrist. Dr. Jones, again, thank you for your service. Thank you for being on this webinar. If somebody want to follow you on social media, because I saw in your bio that you did some reels and things of that sort, they may want to go and see, hey, what was that all about? How can they find you on social media? How are you showing up when it comes to maybe Instagram, TikTok, Facebook, if you're on there? If somebody want to follow you, how can they do that?
Yeah, so for Facebook, it's my first and last name, Demetric Jones. For Instagram, it's Demetric_901. When it comes to social media, I live a private life. I don't share a lot of stuff on there, but feel free to follow me if you would like. And when it comes to my outreach project, I can definitely share that as well. Me and my partner for our outreach project, we're still working on things, but if you follow me and DM me or whatever, I'll get you that information.
Thank you, Dr. Jones. We do appreciate you, and we appreciate you for being a dynamic speaker with us here on this webinar as we're talking about multiple sclerosis and this case that you shared. Man, I was locked in on this case and I just wanted more. I was just like, feed me more, but thank you for breaking it down and for sharing those slides with our listening audience. Thank you, our listening audience, for tuning in. Dr. Jones, I'm gonna let you go as I close out the show, and I appreciate you again. Are there any final words that you would like to say before I let you go?
Oh, Dr. Brown, I just appreciate this opportunity. I feel like it's very important that we continue to raise awareness. And once again, the eyes are the windows to the soul. Everybody need them. I know I would hate to lose my vision partially or completely. So I think you're doing a great job here by raising that awareness and, getting people more geared to taking care of themselves. I feel like sometimes we can neglect our own care, be it for financial reasons or time or whatever, but it's very important to take care of yourself. You only got one body for a short period of time, so value it, take care of your body so it can take care of you.
Preach, Dr. Jones, preach. You're telling the truth. Thank you, sir. I appreciate you for sharing that. Enjoy the rest of your evening, and maybe in 2027 or 2028, we can invite you to come back and be a guest speaker on our webinar again. Thank you so much.
Yes, sir. Thank you.
And again, folks, thank you for listening in on another episode of Protecting the Vision. Our dynamic guest speaker, Dr. Demetric Jones, just highlighted multiple sclerosis and telling us this great case that he had and how they were able to help this patient, and also highlighted how important it is to make sure that you are getting your eyes examined on an annual basis there as well. So thank you guys for tuning in. Please share this with your family and friends. Please come back and join us on next month. In the month of May, we'll have a different guest speaker on, sharing on a different topic. And we want to make sure that we keep raising this awareness on various topics. This is going to be the month of May, mental health awareness. So we're going to have a mental health specialist share with us in the month of May. So come back and be with us in May as we talk about it. The National Optometric Foundation appreciates you, and we want to continue to do the great things that we're doing, helping the National Optometric Association, serving communities at the annual NOA convention. We'll be in St. Louis, Missouri here in 2026. We're asking you guys to come out and help us, and we're going to continue to support our students who are currently in optometry school and those who are thinking about going to optometry school. You're in high school and thinking about a career in optometry. Connect with us. We want to support you. We want to see you grow and be successful. So connect with our NOF. And if you would like to be a board member, you want to be a part of more of what the NOF is doing, contact us. Put some comments in the comment section. We'll reach out to you as well. We're a nonprofit organization doing the best that we can to serve the community, highlight the 3 silent killers of vision. My name is Dr. Timothy Brown, board member for the National Optometric Foundation, Director of Education. It has been my pleasure to be here with you all tonight. Thank you so much for listening in. Again, thanks to our program managers who are working behind the scenes. Shout out to Mr. Nate Kemp, and also to Mr. Jason, Dr. Jason Mahoney, for all the work that they do to help the NOF with these webinars and our guest speaker. You guys have a great night, and I'll see you on the next episode.